How does Obamacare change insurers?
The Affordable Care Act is going to change how we buy insurance through the exchanges. Instead of insurers selling it to companies, they're going to sell it to individuals. And individuals are going to be looking for value. They want a low premium, low deductibles with a high quality program. And that is going to force the insurers to not just take premium and pay doctors, but to actually get into the business of how care is provided, to make sure people are kept healthy and not use a lot of unnecessary services or services that could have been avoided. Similarly, providers are going to come in and they're going to say, hey, I can offer insurance too, and I can take care of the whole patient, and I can do it cheaper than the insurance company. And you're going to have this big competition between providers, which are now offering insurance companies that are now owning hospitals and doctors. And I think that's going to make the whole system more efficient. Much more of a keep patients healthy, a healthcare system rather than what we've had as a sick care system. When people say, we got a sick care system, not a healthcare system, well, the reason we have a sick care system is you pay people to take care of the sick. If you paid people to keep people healthy, and the way to do that is to give them a capitated amount of money. You've got to take care of Ezra Klein, and I'm giving you $2,753 for it, then suddenly if you can care for him at $2,000, all the rest is profit. That's going to be the key. And if he's with you for a long time, you don't just want to stint on care, you just don't want to not do a lot for him, because at some point that's going to come back to haunt you.
I think someone on the left hearing this conversation would say, these are a lot of good but somewhat complicated theories about how insurers can be somewhat defanged. And the problem is having insurers as a middleman at all. And that what we should have done here was single payer. And that so long as you have a system in which insurers are there at all, you are going to have these problematic incentives. Yeah.
Well, but a single payer has the same perverse incentives, right? Medicare, all right, what's their incentive to actually get it right, especially if you don't want to piss off voters? And Medicare is not necessarily the most nimble agent out there. Sometimes it has behaved nimbly, but it hasn't all the time. And if you had all 300 million people in, there are lots of areas we don't know the best way of either delivering care or paying for care. And we're going to have to run a number of experiments over the next 4 or 5 years to get that right. Doing that in one organization is hard. Doing that with private companies, trying some things out, we're going to come to the answer much more quickly, it seems to me.
I am actually a little bit surprised that Obamacare got to 7 million in the exchanges. And I'm curious if you are.
Oh, no. In December, mid-December, after with all the disasters, I made a bet with a private equity guy in New York that we would make 7 million. And he was like, you're crazy. What it tells you, Ezra, really, the pent-up demand for affordable health care insurance in this country, huge. They haven't gone without health care coverage because, I like going naked. They've gone without it because they can't afford it. Now you give them a mechanism to afford it, and they're going to come out of the walls. If we can get this, website and the whole exchange thing working really well so that shopping's under 30 minutes, the website behaves like REI or Zappos, you're going to see a lot more people come out. And I think then the CBO projections for max of 25 million going to look, I predict in the book that we're going to get up to 75 million by the end of the decade.
In exchanges?
Yeah.
Wow.
Yeah.
The theory of Obamacare, the part that I think people miss, they get the sign up the uninsured part.
Yeah.
They don't see as clearly the change the way medicine is actually practiced part. But I think it's fair to say the theory of it is that you put these people into the exchanges. And this massive base of customers connected then to Medicare, which is going to begin adding in different kinds of payment mechanisms, gives government-driven healthcare systems in America the leverage to begin changing how hospitals that work with Medicare deliver care, and then how private insurers end up actually acting with consumers.
I would put it a little differently, okay? What the exchange does is change insurance from a B2B, business to business, to a business to consumer situation. And we know one thing about consumers really, really well. Price, mainly premium, but premium with deductible and copays are what they are shopping on. They're willing to not go to the big brand name to get a lower premium deductible combination. That downward price pressure is going to translate into initially lower prices. So hospitals going to have to take lower prices, docs going to have to take lower prices, and then there's only so much of that you can do. And then the next stage is you got to have to transform your care to lower prices. And we've seen in the marketplace the best places that really have transformed their care, have really focused on keeping people healthy, keep them out of the hospital. Those places can cut about 20% off the cost. That is a lot of money. And so I think that's the wave. That's how I think Obamacare and the Affordable Care Act is really going to transform the system. And that's why I think having a large number of people in exchanges is really the key, because their buying power is going to translate into the insurers and then the delivery system saying, to keep the costs down here and make money and have people in, we need to really transform how we deliver care.
And we talk an enormous amount about cost in the political healthcare discussion.
Yes.
And I actually think that's a mistaken frame, right? That value is what matters here. If healthcare cost exactly as much, but it made people live twice as long, I would not be concerned at all about cost right now.
Right.
To what degree do you think that the other piece of the value proposition is going to change? Which is to say, to what degree do you think Obamacare and what's happening in these markets will actually change the quality of the care we get, the likelihood that if I go to the hospital, I make it out in good shape?
Right. So first of all, I'm not sure I completely agree with you, at least personally, that it's only value. I actually do care about the absolute cost, and I care about the absolute cost mostly because of the deficit, long-term deficit of the federal government. That is healthcare costs, not value. At state government levels, it's Medicaid crowding out primary education, Medicaid crowding out support for the state university system. So I am concerned about the cost, and it's not just the value. But to get to the second part of your question, which is about can we improve quality, the first thing I would say is in the Affordable Care Act, we had a number of incentives to change quality. One of the things I'm proud of that has gotten hardly any attention is the Partnership for Patients. So in 2010, Don Berwick and a bunch of us in the White House helped design a program to work with hospitals to reduce their infection rate, to reduce their elective cesarean section rate, to reduce falls and other things. And recently a 3-year evaluation, remarkable success. So central line infections down 40%. If you're on a respirator, down 50%. Early elective C-sections down 50%. Falls down, I think, 11 or 12%. Big success. Not turn the corner, not, we're done, but improvement. And the last thing I would say is that part of the secret, at least of most places that have been able to really reduce costs, is to focus on the chronically ill, the 10% who use most of the money, and keeping them healthy. That's a big quality improvement. And that, I think, is going to have to be the focus for the next 6, 7, 8 years until we get that exactly right.
How do you think the White House feels now that they actually hit 7 million?
I think they feel fantastic. I'm just a little worried that they might think, success, we got the gold medal, we can go home now. The problem with medicine is there's no going home. There's no final gold medal. There's no resting point. It's a $3 trillion industry. It's very dynamic, and you constantly have to change. So, the website has to be upgraded substantially before open enrollment starts in the fall, because you have to get it to be much more user-friendly. You have to get the shopping experience down under 30 minutes. You have to get better products out there. They've been so concerned just about the website and getting the mechanics right that I think running it as a real startup that gets the customer experience really optimal is something that they really need to shift their focus to.